What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. So I wanted to record this particular video for those of you who are getting into your own private practice, you're getting into your own virtual medical practice, and you're sort of drowning in the kind of patients you're seeing. One day you're getting this kind of patient, one day you're getting that kind of patient, and you really want to streamline your practice. In fact, you might be looking at a lot of other practices out there and seeing how streamlined it is. Like, they have these concepts, these ideas, and they just reproduce that. And I'm talking about the large direct-to-consumer telemedicine practices. So when you build your own medical practice, in the beginning, of course, there's a lot of moving parts. There's a lot of things that you're going to adjust as you go. And oftentimes, as I always say, your patients are the ones who are going to dictate what your practice is going to look like. I feel like I'm learning that a lot in my own virtual medical practice, and I think a lot of other physicians who've shared their practice with me, when I coach them, it's the same thing. Eventually, they settle on a group of patients. But from the get-go, you need to have a concept, you need to have a framework in place. That is often what people gravitate to. Medicine itself is very broad. Medicine is also very bewildering. To a lot of people, it's sort of confusing. You're not quite sure. What are you offering? What are you not offering? What is it you're doing? What is it you're not doing? When you create a framework, some sort of an algorithm, people have something to ground themselves to, and they can sort of understand it. And every single time you create content, every single time you run an advertisement, every single time you post something on your website, you can constantly refer back to that framework. Let me give you an example. So for drashori.com, this is my health coaching practice. It's my health coaching practice into which I feed primary care patients. So I do the health coaching, somebody's interested, they want to become my long-term primary care patient, they can become my long-term primary care patient as long as I'm licensed in their state. But when I do the health coaching, I can do that in any state. The way I have started communicating with people, the way I kind of present what I do, and remember, when I do online stuff, when I do social media stuff like this, I'm not doing it to get as many people as possible to subscribe to my channel. That's not the point. I'm just using YouTube essentially as a way to store my videos because I couldn't host that all on my own website. I could, but it just would be ridiculous. So I want the people who sort of already know a little bit about me to watch my stuff, get a better idea, so they maybe found out about me through some other source, through maybe one of my advertisements, and then they come and read or listen. I go, okay, interesting. This is what this guy's about. So at drashori.com, I created a concept called TREND. It stands for testing, relationships, exercise, nutrition, and downtime. So this is the concept that I use. This is the framework that I use for everybody who comes into my practice. So we do the testing, and then we focus on all these other bullet points, and I have this other model attached to that. So I say, what is it that I can do for you? What is it that you can do for you? What is it that Western medicine can do for you? This framework is something that people, they kind of gravitate to it. I can't quite explain it, but when they say, oh yeah, and you know, like how in TREND you say nutrition is this, or this, that's perfect, because now we're using a very constrained space to have a communication, to have a conversation in, and people find that to be more dependable, more reliable. It's a way for them to identify you. Sometimes as a patient, you're like, wait, what are you? You're a primary care doctor, but you're talking about healthy aging, you're doing this, you're doing that, I don't really know. Wait, can I get my cholesterol medicine through you? Can you tell me about this? Can we talk about cardiovascular health? Can we talk about addiction, right? And so then you get confused, but then when you have this framework in mind, all of a sudden, there is a way to talk about a topic. So somebody wants to talk about addiction, somebody wants to talk about their interpersonal relationships, and now you have a framework from which you can have that conversation. The way to use it is to make most of your content and pieces that you create or the conversations you have with your patients focus on that framework. And it can be something that you can visualize really beautifully so it can become an advertisement. But it's something that's repeatable. It's something that becomes familiar to people, and it's less likely for somebody to get confused by all the different things that you say. Now, how to introduce it? There's no there's no clean or easy way to introduce something like that. Now, you might know a lot of social media doctors, physicians who are on social media, who either have their own practice or mostly are just, talking heads, like social media people. They will eventually introduce some concept. They will eventually introduce some sort of algorithm or framework or something that they're going to constantly refer to. When you do something like that, you connect better with the patient. You can explain a complex topic in a more approachable manner. And the patient is going to find a lot of solace, and they're going to find a lot of comfort in knowing that you have thought through this concept, and it is something that you can always explain to them in many ways. Now, it doesn't work for everyone. It doesn't, certain concepts are always going to fall outside of it, but most of the time, all the content you create online can always refer back to this. And it's going to, there was a term that my social media person used for it. It's going to, I forgot. Anyway, she basically said that as we constantly create this piece or that piece of content or that piece of content, or we create one piece on Mondays and Wednesdays that is usually referring back to this, it's going to make the people who are in your audience feel much more familiar with your material, and it's going to be easier for them to grasp. So I just wanted to introduce it, whether you're an addiction doctor, whether you're a sports medicine doctor, whether you're some other mental health expert who wants to build their own virtual medical practice. Come up with a concept. It could be around ADHD. It could be around weight loss. It could be around exercise. It could be around joint pain, chronic pain, migraine, skin, acne issues. But a framework and a concept that you follow, like the 5 pillars of, the 4 pillars of. And of course, we can use all these large language models these days to help us kind of refine it, come up with the proper terminology and words to use it. I hope this is of value to you guys. Go to digitalnomadphysician.com for more information. Thanks for tuning in.